Let's have the continuation of last class that we were discussing electrical safety and different types of shock, that is macro shock and micro shock. In this class, we are going to discuss what is the severity of the shock. Okay, so this severity of the shock, it is always depends upon the amount of the current which is being flow or which is being passed inside the body. So there are so many factors which is being influenced to determine the shock severity. The first one is the type of current what we are passing, whether it is AC current or DC current. So compared to the DC current, the AC current is a very dangerous because it is a continuous mode type of current. And second one, this current characteristics, that is the voltage, amplitude, and frequency. These are the three parameters which has high much influence on determining the shock severity. So it is like what kind of voltage or what amplitude or what frequency the current is being passed. Based on that, the severity of the shock will vary time to time. And then contact time and area also plays very important role, because the duration during which the current is being passed, or the area or the contact area or the targeted area is being exposed, it also matters a lot. And also we have a important parameter, one more thing is that electrical field strength. And last one is the path of the current through the body, that is the current the path of the current through which the current is passing to the body, whether it is external or the internal. It also plays an important role for determining the shock severity. And finally, the patient health condition, it also one more criteria. Based on that also, the severity of the shock will get vary. The reason is that maybe some patient is having very low skin resistance or very high skin resistance. And also the patient maybe have some internal electronic device like implantable device like cardiac pacemaker or some other thing, or the patients have very weak health conditions. So these are the thing, or they don't have any high resistance property to this current. So based on their patient health condition also, the severity of shock will get vary. So these are the different factors. Next, we will see the effects of shock. The effects of shocks falls in three categories. First one is minor shock, second one is severe shock, and third one is extreme severe shock. The first one, minor shock, during which the patient will have the consciousness. Maybe they have mentally disturbed, like they may have gone to a distressed state or a disturbed state. They may got frightened or and so on. And but in severe shock, the patient BP will drop out, and may they go to conscious, that is go to loss of consciousness. And last case, that is the extreme case, that is the case we have to be give full attention in order to recover their life. Example, they in that case the patient may feel a stoppage of breathing, that is the cessation of respiration. The patient may have a cardiac arrest, or they don't have the carotid pulse. The person will not have the pulse sensation, and they have a fully dilated pupil also. So these are the different effects of shock you can notice in the patient. And this slide, that is the electricity and its impact on people. It means that the physiological effects of electricity, once the electricity is being passed, it's being passed into our body irrespective of any range. What are the different possible physiological effects it's being happen inside the body? That is the thing it's being clearly explained in this slide. So here if you see that pictorial representation, right from 1 milliampere to 300 milliamperes, I have listed out here. For that each milliamperes, you can see the equivalent physiological effects happen in our body. If we start with 1 milliampere, the patient will not have any sensation, that is a no sensation. Then if you are passing 1 to 3 milliamperes, then they have the sensation, that they can have the feel, but without any harmful effects, that is they don't have any pain. And if you are passing 3 to 15 milliampere, means they have the pain, and also the most people can get away. It means that the people will move away from the source. They can feel the pain, but immediately they can move away the source, that is the let go current. And next one is 15 to 30. Here they have where the people feel the pain and of the people will get freeze. It means that AC power will hold the people, which prevent the people from let go. So this is the case. You have to be very careful. That is 15 to 30 milliamperes. So beyond all the milliamperes, every increment in milliamperes, the current passage will totally disturb your physiological function. Like it will affect your breathing, it will affect your heart, and it will affect your all other physiological mechanism. So it will lead to burns, or even it will end up with the heart stoppage. So these are the different cases of for each milliampere increment. You can see the equivalent physiological effects. So what are the prevention we can take in order to like avoid this sort of healthical hazard? In the sense, first you have to be focused on a few more steps, like insulation. You have to maintained in all sort of electrical equipments or electronic devices. There you have to use non-conductive materials, because these materials will have a non-conducting property, so high resistance to the electricity. So this will prevent the leakage current from entering into the patient. So that the first one is insulation. Second one is the guarding, that is a protective layer. So if you have any exposed wires or something, any live wires, that has to be covered by some protective layers in addition to the insulation, so that no more leakage current will get escape, and the people will also have a very safety in all the means. Okay. Then grounding is a very important thing that you have to ensure before using any sort of a medical device or electronic device with the supply of mains, that is 230 volts with the 50 hertz. This main supply should have the proper grounding, and also the device whatever it's being connected to the main supply also be have proper grounding, that is the lives and neutral should be connected properly. And then electrical protective device also you have to be encouraged to use. Those tools are like fuses or circuit breakers, because these will prevent you or alert you if there is any short circuit or any overshoot of current and so on. So then so that the electrical protective device also is very much encouraged to be used in order to have a prevention of these electrical hazards. And finally, the last point is the safe work practice that have to be employed in all the means. Like here, the safety rules you have to be followed, like wearing PPE and using the insulated tools, or you have to have proper maintenance of medical device. You have to ensure each and everything in all the aspects of insulation and proper grounding and guarding and everything. So safety work practice has to be ensured in order to like prevent any kind of electrical shock. So these are the things we have to be followed to prevent the electrical hazards. Thank you.